Hello dear students, welcome to my channel. Okay, so today I am going to discuss about the psychiatric nursing terminologies. Okay, I think my classes are quite helpful for you in preparation of your competitive examinations. So you please keep watching my videos. I will be keep uploading more and more videos so that are going to help you in preparation of your competitive examinations. And all of you please subscribe for the notifications that will be notified when you subscribe to my channel. So I guess you just subscribe to the channel. So today we are going to discuss about the psychiatric nursing terminologies. So you can expect at least one or two questions from this one. In the area of psychiatric nursing, they will ask many times they have asked questions from the terminology itself. Okay, so let's begin with the psychiatric nursing terminologies. So please watch the video from beginning to end. Okay, let's begin. First one is apathy. Apathy is nothing but a lack of emotional response. Okay, the person does not have any interest in doing anything. Okay, the person does not have any enthusiasm. Okay, if you ask him to come for playing cricket, if you ask him to come for watching the movie, so he'll always say no, yeah, I'm not interested. No, so he'll have not enthusiasm. Okay, does not have any enthusiasm, does not have any interest in any activity. Okay, so apathy is nothing but a lack of emotional response, lack of interest or enthusiasm in any activities. Apraxia. Okay, next one is apraxia. Apraxia is nothing but the person does not carry out the normal activity even though motor function is intact. Okay, here the person motor function is intact but does not carry out the normal activity. He always lying on the bed and asking his family member to take care of him even though his motor activity is normal. Next one is aphasia. Aphasia is nothing but impairment in the communications. Okay, the person does not the person will have impairment in the speech, impairment in the writing or making any signs for the communication. Okay, so this aphasia we have three types. Okay, it is always aphasia is always due to organic brain disorders. So we have three types of aphasia: sensory aphasia, motor aphasia and nominal aphasia. Okay, so sensory aphasia means sensory aphasia is nothing but here the person is able to produce his thoughts into words but not able to understand what he speaks himself and what others speaks. So that is nothing but sensory aphasia. Motor aphasia means in this the person is unable to produce his thought into words. Whatever thoughts coming to his mind, he is unable to produce that thoughts into words. Okay, but he is able to understand what others speaks. That is a motor aphasia. And nominal aphasia means the person is able to describe everything about the objects but cannot name it. For example, this is a an object. Okay, he will describe everything. It is made for writing. It has a cap. Okay, it has a ink, everything is able to describe about this one but he cannot name it as a pen. Okay, so the person is able to describe everything about the object but cannot name it. That is known as a nominal aphasia. Okay, next one is ambivalence. Ambivalence is nothing but there is a coexistence of two opposite emotions on the same person at the same time. Okay, it is like a father is loving and hating his son or daughter at the same time. Okay, at the same time he is loving and hating his daughter or son. Okay, that is known as a ambivalence. Okay, next one is amnesia. Amnesia is nothing but it is inability to recall, register the past occurrences. Whatever the past occurrences is unable to recall or memorize or remember. Okay, or register. That is known as a amnesia. Okay, so we have two types of amnesia, that is anterograde amnesia and retrograde amnesia. So what is anterograde amnesia? Anterograde amnesia is nothing but the person is unable to recall the events which have occurred after the episodes. For example, a person is met with an accident. Okay, so he is unable to recall the events which have taken place after the accidents. After the accidents, whatever the events that have taken place in his life, he is unable to recall. That is nothing but anterograde amnesia. Next one is retrograde amnesia. Retrograde amnesia means nothing but here the person is unable to recall the events that have occurred before the episodes. For example, a person is met with an accident. Okay, he is unable to recall the events that have taken place before the episode of accident. Okay, before the episodes of accident, whatever the events that has taken place in his life, he is unable to recall. That is known as a retrograde amnesia. Okay, next one is anhedonia. Anhedonia is nothing but the person is unable to get pleasure in any activities. Okay, the activity which were pleasureful to him in his previous life, okay, in his past life, so those activities are absolutely become unpleasurable. For example, watching the movies or playing the cricket were pleasureful to him in his past life. Now those activities are absolutely not giving any pleasure to him. Okay, so anhedonia is nothing but the person is unable to feel pleasure in any activities. Next one is anxiety. Anxiety is nothing but it is an apprehension that is associated with the uncertainty and helplessness. Okay, so the person who is going to write for examination, he may have uncertainty of whether he is going to pass or fail, so he will have apprehension. Okay, so the apprehension that is associated with the uncertainty and helplessness, that is known as the anxiety. Okay, now let us discuss about the artistic thinking. So artistic thinking is a mental activity in which the person thoughts and activities are always towards the inner side. Okay, means he will be thinking about his own self, he will be lying in his own fantasy life, always he will be daydreaming. Okay, and does not keep in contact with the reality. He will always loses the touch with the reality. Okay, it is nothing but artistic thinking. Okay, next one is automatic obedience. Automatic obedience is nothing but the person will obey all the commands given by the others. Okay, irrespective of understanding the nature of the commands. Okay, for example, if an examiner asks the patient to take a pin and prick yourself, okay, the patient will take the pin and prick himself. He will not understand the nature of commands given by the others. See, he will follow every commands given by the others. That is nothing but a automatic obedience. Next one is anorexia nervosa. Anorexia nervosa is a mental disorders characterized by persistent concern about the one's own weight. Okay, the person is always concerned about being going to become fat, and he avoids the food and fluid. Okay, so always he try to keep his weight less than the normal. Okay, so he keep on becoming lean and lean, thin and thin. Okay, so that is nothing but anorexia nervosa. Okay, so these are the few terminologies I have discussed today. So in the next upcoming video, I will be discussing the other terminology in the psychiatric nursing. Okay, so if you like today's class, okay, so please press like button, and if you new visitors to my channel, please subscribe to channel and share to others as well. Okay, so please keep watching my video. I will be uploading more and more video. Okay, thank you very much. So soon I am going to upload one more video on the psychiatric terminologies. Thank you very much.